Good afternoon. Lee Harris, Shelby County Mayor, pleased to be here on behalf of the Joint Task Force. As you know, vaccine administration has begun, and although the process for receiving a vaccine, if you have received one, has been smooth, too few of our residents have had access to the vaccine. As you know, we received the vaccine from state and federal authorities, and the national supply of vaccine, as far as we can tell, has been limited. As a result, the number of vaccine appointments that have been made available are also limited until that supply is opened up. We're hopeful that things will change here relatively soon, particularly hopeful because of the prospect of new manufacturers of the vaccine coming online. In addition to that, we have been encouraged by the public comments of national leaders as a new administration takes the reins. So we will continue to work to make sure we're prepared in case vaccine supply opens up. And in the event of the vaccine supply opens up, we are prepared to have a standby list. And so that's what we are opening up today, is a standby list that will be operationalized and useful should more vaccine supply open. Our standby list is called VaxQ, and with any luck, you should be able to see a screenshot of VaxQ right now. And VaxQ is one of the ways we will maintain a list of those individuals who have not yet received an appointment for a first dose but want to be on standby if there are unexpected changes to our vaccine supply. At VaxQ, you'll be able to enter your name and additional information like your relative risk of facing severe complications from COVID-19 because of a health condition or because of your career. Again, you can see all of that right now. The hope is that this will give the health department the ability to reach out in a more pinpoint way to give notice of any changes in vaccine supply. Additionally, the hope is that individuals will have even more reliable information about the availability of vaccine supply. Let me also say, keep in mind that a standby list like this is pretty similar to a standby list for plane travel. This list will likely involve some waiting, and unfortunately, because of limited supply, there are no guarantees. Furthermore, this standby list is not, strictly speaking, a first-come, first-served. Any availability of supply will still track the state criteria and focus first on those who are most at risk of contracting COVID-19, spreading it, or suffering severe complications. We encourage people to sign up if they could not get an appointment and want to keep informed about unexpected changes in vaccine supply. The sign-up should be available now at Shelby.community, where you'll find a host of information about the COVID response efforts. Again, Shelby.community if you want further information or sign up for VaxQ. At this time, I'd like to welcome to the podium the Director of the Health Department, Director Haushalter.
Good afternoon, everyone, and thank you, Mayor Harris. I'm going to give a few data updates, and then we're going to spend the majority of the time today with updates from Dr. Martin on our vaccine distribution locally, then open it up for questions. We are doing quite well at the current time, and all of our numbers are trending in the right direction, so that's a good sign. But it's a testament to this community and our ability to work together and do all the difficult things that we need to do to reduce the impact of the pandemic locally. So I want to thank you on behalf of our health department team, but also more broadly the Joint Task Force. As of this morning, we have 80,991 deaths. That's an increase of 221 in a 24-hour period, so much less than what we were experiencing in December and through the holiday surge. Unfortunately, we have had 1,202 deaths, and we are still experiencing hospitalizations and deaths that are related to the holiday surge, so this is not unexpected, but clearly we will mourn every death in our community. Our current mortality rate is 1.5%. That's higher than it had been for a period of time, but still less than what you see in many other communities across the country. As I noted, all of our trends are moving in a positive direction, so our 7-day average of cases is below the 450 mark that we had set as a tripwire, and that has been 392 for 7 days. For the 14-day average, we've experienced 427 new cases per day on average. But most promising to us is our reproductive rate is declining very quickly with the decrease in the number of cases. So our reproductive rate now is well below 1 at 0.79, which is extremely positive. Our test positivity rate is still at approximately 12%. What I wanted to highlight also is that we still have plenty of testing capacity, but we also know testing is trending down. So we want to continue to encourage people to get tested, and particularly those who are under 40 or those that work in professions that they're more likely to be exposed to COVID. We're going to continue to focus on early detection of COVID, early isolation, and then early quarantine of contacts. So that really is dependent on each and every one of you getting tested on a regular basis, particularly, again, if you're under 40 or if you're from a high-risk employment. Our hospital capacity, while we are having improvements in capacity, we again are seeing the impact of the holiday surge, but our hospital systems have continued to address and manage that surge without difficulty and have plenty of capacity to serve this community. Lastly, I want to talk about public health capacity. We're doing everything we can locally to be innovative and to use technology as much as possible. So we are implementing a text-based notification and contact tracing that's been used over the last week, and we are seeing improvements there, and we'll continue to use that, but make tweaks to it based on whether or not the customers who have been notified are using it properly. So more to come on that. But it does reduce the number of phone calls that we would make and allow us to redeploy some of those assets to vaccine distribution. So our biggest efforts now really are still on contact tracing, enforcement, and then vaccine distribution. So I'm going to ask Dr. Martin to come up and give updates on where we are with vaccine distribution, but where we're going, particularly as we know we'll get more supply of vaccine. Thank you.
Thank you, Dr. Haushalter, Mayor. So I'd like to just share that I am, again, Dr. Judy Martin with the Shelby County Health Department. I'd just like to again, share where we are at this point. At this point, we've administered to date 17,279 doses of COVID-19 vaccine. Those doses have been administered to the phases 1A1, 1A2, individuals 75 and older, and individuals 65 and older that have comorbid conditions. You may recall that from December 28th through January 3rd, 9,470 individuals received the COVID vaccine at 2 different locations, Sycamore View and also Lindenwood. It's now time for us to administer the second dose to those individuals. And so that is about to launch. At this time, we're preparing to launch those vaccine administrations in various locations. You may also know that, and the appointments are currently available. You may also be aware that the Pipkin building is our base current site for receiving first dose of COVID vaccine. At this time, we have moved up to that 1A2, and you may notice that the state in their plan have expressed that the age can be reduced at this point. Please be aware that Shelby County, because our population is much larger than the population in certain other counties in the state, it will take us longer to get to where we have covered all of the individuals in phases 1A1, 1A2. And so that is the situation that will cause us to take a little bit longer to get to dropping the age limit for those who can receive the vaccine. I want you to be aware that, again, Pipkin is our base site. It's been our primary, is where we're working from, and we're administering vaccines 5 days a week from 9 to 6. Tuesdays through Saturdays by appointment. But we opened a new site today where we're administering first dose vaccine, and that's at the Commodity Center, CSFP, the Commodity Center that is located at Bellevue and Walker. Now, that vaccine is available to individuals who are eligible for the CSFP or commodities program. And the individuals that have presented there, they were notified in advance. All that were eligible, they were notified in advance. And those individuals, as they present, they're offered to the opportunity to receive the vaccine today. The reports that I've received at this time, it opened at 8:30 this morning. The information I've received at this time is that things are going very well. Persons are receiving the vaccine and that all is well, is moving smoothly. I just want to share also that we are looking to scale it up. We're looking forward to expanding our vaccine efforts, as Director Haushalter mentioned. And so we're looking at doing it different ways. We're looking at, of course, the zip codes where there are areas that are in great need. We are meeting with we're meeting with individuals to hear their need and hear their requests, but we're also working on the legal aspect of developing MOUs. MOUs they've been developed now and they've been communicated to the individuals or the agencies that we're about to interact with or work with in the very near future. I want you to know that one community that is underserved that we are working with is in the Whitehaven area, and there is work in progress. Our hope is that everything can be resolved very quickly so that we can be ready to launch that one very soon. I don't want to mention the date, but we're looking at next week, and so we're really excited about that because that is a first dose location, which is what most people are really anxious about, receiving that first dose. In addition to that, there are other communities in Shelby County that have expressed the need, the desire to establish facilities to where we can administer the vaccine. In addition, there's the faith-based community that we've been receiving communication from. Additionally, as we're trying to get through this first phase of 1A1 and 1A2, there are special groups that need to be addressed. And so we think about people who live in poverty. There are the homeless, individuals that do not have the ability to, because of developmental disabilities, don't have the ability to provide, to access the care for themselves. And so we're in conversation, in planning, to establish events where we will be able to serve those individuals as well. And so I just want to just remind that our big focus is equity and access. We understand that we learned that we have to be able to have access, allow people to access as they need to. So, for example, we have the online ability to sign up for appointments. Also, there is the hotline where people can call in and request notification when appointments become available. But we also have an opportunity in that call-in number, 901-222-SHOT. There is also a queue within that phone line whereby if an individual is not able to access for an appointment and they need assistance to make an appointment, there is a group of people set aside and available to receive that call and to assist people to make that appointment. And that's really important because that is something that we heard. Some people tried to make an appointment but were not able. Know this also, for those people, there were a certain percentage of appointments that were held aside to make certain that there were appointments for them to receive the services that they're seeking. I think that's really all I have to offer right now. I think we are available for any questions if there are questions. Thank you.
Kelly Roberts, WMC.
Good afternoon. My first question is just about a situation that happened over the weekend when it comes to that, whether it was a text or an email, but that notification that went out alerting people that they could get a vaccine without an appointment if they fit certain criteria. I just want to hear, from the health department on, exactly, if that was what you all intended. I know it caused, a long line, some people with appointments not able to get in as well, stuck in that very long line. Was that how it was intended? Did word of mouth kind of get overrun there? Can you talk about that? And I was going to ask, how do you get on the list to get that notification? But it sounds like, is it now that Vax queue that you would get some sort of notification like that in the future?
Yes. Okay, thank you. So I'll just start with what the issue that presented. The issue that was really apparent is that let me start with the fact. The fact is we need to get the vaccine out. The issue that presented was that as I'm sharing with the director daily the number of vaccines that are administered at the location. The numbers had decreased a bit, all related to no-shows. Appointments had been made, but individuals were not showing for their appointments that they had signed up for. If they had canceled, someone else could have had the opportunity to get the appointment, but that didn't occur. As a result, what will happen in Shelby County is that if we don't administer vaccine at a certain level, we won't continue to receive that level of vaccine. And obviously, we won't be able to increase the amount of vaccine that we need in this community. So what we saw Saturday morning, when I drove to the property, I saw 3 cars in line at around 9:30 in the morning. Yes, some individuals had been seen and were in the monitoring lot, but there were only 3 cars in line, and that's unheard of, unacceptable. It was obvious that there were a number of no-shows for the day already. Spoke with the director. I called 5 people. And 5 people who I know fit into the current phases. And I called them for that reason. And they asked, okay, well, so you're saying they have to have, and I verbalized, these are the phases. You know what they are. It's this. And these professions, and then 75 and older, and 65 if they had certain comorbid conditions. I went on to even explain what was not acceptable, where someone might say, oh, but I have a comorbid condition, but I did tell them, no, that's not included. It includes, and was very specific about what's included. So, again, I shared it with 5 people, and people spread the word. The intention was that that people would come to receive the vaccine if they were in a situation in need of and in desiring the vaccine that day. Now, let's see, what was it? It was something else.
She asked about people who had appointments didn't get seen.
Okay. And so the people who had, so I'll go to that one. And so another thing is this, I need to make a point. Again, there are people who have asked to be put on a list. On Saturday, we did not have access to that list. The list had not been formalized at that time. And the system had not been formalized. And so that's the reason I called that 5 people. Now, I will tell you, I want you to know that what the plan was, what was attempted was that anyone who drove up, who had an appointment, the instruction was that they would be escorted to pull out of line to move to a separate line. And so there was a line for individuals with appointments, and then there was a line for people who were as available, if that helps. I'll just move ahead with just sharing something. One thing that I'm really pleased to share. First, I was not happy that things went the way they did, because yes, it was an extremely long line. I did not expect that. No, that is not our intention. But I was really pleased to find that at the end of the evening, when we did the count, the number of doses that were administered to individuals that were not scheduled they did not have appointments was 500. We actually administered 1,170 doses that day. That far exceeded the number that we have been administering daily. So it was a win. It was a little bit of a situation because, of course, we don't want to inconvenience anyone. Now, I will share, in being transparent, I received notification that there were 3 individuals that called to express that they had appointments. They were in line, but they were incorrectly told they were turned away. Those individuals, I made a personal call and spoke with each of them, and we made arrangements for them to be seen without any wait, and to move them to the front of the line so that they can come in at their convenience. They were they were surprised at a call. And they expressed that they were pleased that we cared and that we were trying to accommodate their concern. I hope that helps, and I hope it answers your questions.
Yeah, it certainly does. Thank you. My second question is just about locations. You know, it looks like those 3 locations, well, one being the Pipkin building, of course, but for the second doses, you know, have opened up. Do you anticipate that the Appling and the Germantown one will eventually move to first dose sites? I know you've mentioned Whitehaven often, but I know that there's a lot of talk about equitable access. You know, what kind of work do you feel like still needs to be done to make sure sites are opening in spots where the risk is high, where it can allow equitable access to everyone in Shelby County?
So I think the most important part of the work is going on right now, and I made reference to the MOUs, the contractual arrangements that have to be put in place to in order for us to be able to operate within a facility with the health department coming in to provide the vaccine. There are a number of agencies, other municipalities, facilities that have received the MOU, and they're in the process of working through the legal work that has to be done to make that a reality. There are a number of other facilities and areas, municipalities that would like to also have that type of an arrangement. I've received communication from several, and in a meeting with them this morning, I shared what part of what is required in order for us to even consider doing something at that location, and they have set about looking to identify the locations that meet those requirements. But there would have to be the MOU process where there is a review between the legal representatives to make certain that everything is in order and all understandings are clear.
I just wanted to add a few comments on locations. One, the health department has locations, but also healthcare systems have vaccine. But in the statewide plan moving forward, primary care providers may also have vaccine. Pharmacies may also have vaccine, as well as the safety net providers. So as we're looking at different sites in the community, we also have to be sensitive to where there may be a safety net provider that will be able to provide vaccine, as well as those pharmacy locations. And then, as was noted, we have to make sure that it's a place that we can have the volume of throughput. And then your other question was whether or not Germantown or the Appling sites would ultimately have first doses available. And in every site that we will partner with, we will explore the possibility of first and second doses. Just keeping in mind that we have both Moderna vaccine and Pfizer vaccine, first and second dose. So we need to organize things in a way that there isn't a potential error because we're using different vaccines at different sites. So yes, we will explore that, but want to make sure that it's done in a safe and organized way for the public.
Fred Broders, Local 24.
Thanks. Good afternoon, Dr. Haushalter. It came out this morning that the Biden administration is expected to increase the supply to the states and counties by 16% next week. I know you all were planning on it being planned 8,900 this week, but what do you anticipate maybe getting additional supply next week in the February weeks? Do you have any preliminary information on that?
So based on conversations that we had with the Tennessee Department of Health this past weekend, we anticipate additional 3,000 doses being available to Shelby County next week. And so we know that that'll occur. We anticipate that that's pretty likely all the way through February, but may also increase. But we also know that the state health department is in contact with some big box retailers to provide additional support. They will also receive vaccine, but not part of our overall allocation. They will receive directly from the CDC, which would then add several thousand doses above the 3,000 that I've mentioned. So that's why it's critical right now that we look to scale up operations so that when we get more vaccine, we can get it out to the community in a very clear, clean, and effective way. Your follow-up, please?
Yes, thanks. I know some doctors last week here locally were talking about the state should maybe reconsider its per capita formula to help Shelby County catch up more with some of the other counties who are already moving into other groups. Do you believe the state should look into that as we're trying to vaccinate obviously larger populations?
So I do know that the state is considering all of the different ways to explore the formula. And the formula is not limited to per capita. It also has a vulnerability component to it. And that actually influenced the fact that we were going to get 3,000 more doses. So one, I know that those who have advocated directly to the state are being heard. And I know the state is recalculating things to make sure that we get our fair share locally. But I will continue to remind everyone, we have the largest population in the state, and unless we get large volumes of vaccine, we're going to continue at this same pace. So the more vaccine we can get, the more that we can get it out to our community.
Michaela,
I think if I just want to add one additional comment to that, because I know there's a perspective that we may be slower locally, and I would say that's not accurate. None of the providers locally, including the health department, have any unused vaccine. All the vaccine we're receiving is getting out to the public. It's just that our proportion per population is lower because our population is so large.
Michaela Watts, Commercial Appeal.
Yes, good afternoon. Dr. Haushalter, considering that it looks like we're now moving through the numbers from one holiday surge after another, is it accurate to say the pandemic might have peaked at a local level? And what happens for that to be the case?
So we could say that it peaked, but I actually would be cautious about using that terminology for two reasons. One, and this is foremost, is that there are variant strains. And if those variant strains come to our community, we can see another surge. The other is that if people sort of have any lapse or lax in their hygienic measures, wearing the mask, social distancing, and so on, our numbers can go back up. So we really want to caution people not to get complacent. We're not through the pandemic yet. And then your other question had to do, when is it peaked? It's really by looking at that epi curve that we draw out, how far it goes up and when it begins to go back down. But in any pandemic, you can have multiple peaks. So we are at a second wave of the peak from what we looked at early in July. Everyone remembers the end of June and July, we had a very high peak. We kind of went down, then we went right back up again. And so we'll just have to continue to monitor. And while the vaccine's going to move us in a positive direction, we're by no means out of the woods at this point.
Great, thank you. And for my follow-up question, I'm just curious, it sounds like no-shows for vaccination appointments are somewhat of a significant problem. For the people that, for whatever reason, miss their allotted appointment, what happens next? Do they, lose their place in line, or are they able to reschedule fairly quickly?
People will be able to reschedule if they missed it. One, keep in mind, people may have been able to get it elsewhere. So we don't want to make an assumption that people just didn't show up because they didn't keep the appointment. They may have found another opportunity. We do know that people go across state lines and across county lines. They may have lost their ride for that day. There may have been a lot of things that contribute. So we want to make sure that if someone missed an appointment, that they can reschedule and come in whenever they're ready to be able to come in for that vaccine.
Siobhan Riley, Fox 13.
Sorry, I was muted. I just wanted to ask about 90122 shot. I know that I've been getting a few phone calls and emails from folks who said they have called the number, they can't get through, or either they call and they are on hold for a very long time. I just wonder what is the department doing to correct that problem?
So one, if we receive complaints or feedback that it is taking longer, we can increase the number of lines available and the number of staff, so we'll follow up. Generally, what we found is the first day at the early part of the morning, a lot of people were calling in at one time. We did reassign some additional staff and actually had those phones forwarded to even more additional staff, but it was a large number of people who called in. So I encourage people, if they have feedback or experienced a specific challenge, they can email us at Shelby TN Health, and we will use that information to continue to improve our system.
And my second question, I spoke with Pastor Bill Atkins of Greater Imani Church in Raleigh last week, and he had a lot of concerns. But one of the things he did tell me is that he would be willing to use his church as a site where people can get those vaccines. Is this something that the department would consider?
So we have a lot of people who have volunteered space. They need to do that in a formal way. They can do that through Shelby TN Health. We will also be working to have a portal online so that people can submit that information online. We will consider the various sites, but there are key things that we have to look at. One is geographic distribution. We are looking at the equity component, but from a delivery perspective, we have to make sure that we can accommodate the cars that need to come through without obstructing traffic. We have to make sure there's sufficient parking for monitoring afterwards, that there's sufficient coverage to protect those who are administering the vaccine and so on. So we will consider all locations, but then we have to use those filters to make a final decision on one, either a permanent site or a temporary site. So please encourage the pastor to send that information to us directly so that we can follow up.
We are out of time. Are there any closing messages today?
Just want to encourage people again to get tested and then to continue to monitor Shelby.community for updates on the phases of vaccine administration.
Thanks, everyone. We'll see you back here on Thursday.